So today's class is clinically important. It's on inguinal hernia. Now what is a hernia? Hernia is an abnormal protrusion of a viscus or a part of viscus through an area of weakness. When the protrusion takes place through the inguinal canal, we call it the inguinal hernia. Now in this diagram, we can make out the location of the protrusion in case of indirect inguinal hernia and femoral hernia. Femoral hernia is more common in females due to the small size of the vessels, femoral vessels, and the broader pelvis. While in case of males, the inguinal hernia is more common due to the larger inguinal canal in males due to descent of testes from the abdomen to the scrotum. Now what is the indirect inguinal hernia? Indirect inguinal hernia takes place lateral to the inferior epigastric artery through the deep inguinal ring. The contents pass through the deep inguinal ring through the inguinal canal, come out through the superficial inguinal ring. So this type of inguinal hernia is common in children and young adults, and it is due to increased intra-abdominal pressure. In such a case, we call it acquired indirect inguinal hernia. This type of hernia may also be due to the persistence of the processus vaginalis, which connects the peritoneal cavity with the tunica vaginalis, and in such a case we call it a congenital indirect hernia. So see, it takes place lateral to the inferior epigastric artery and the contents protrude through the deep inguinal ring. So the coverings of an indirect inguinal hernia will be the peritoneum, extraperitoneal connective tissue, the internal spermatic fascia, the cremastric fascia, the external spermatic fascia, and the skin. Direct inguinal hernia takes place medial to the inferior epigastric artery. Here the contents protrude through the posterior wall of the inguinal canal, and the protrusion takes place in the region of the Hasselbach's triangle. Now this is a triangle which is bounded by inferior epigastric artery, lateral border of rectus abdominis, and the inguinal ligament. So when the protrusion takes place through the posterior wall of the inguinal canal instead of the deep inguinal ring, we call it the direct inguinal hernia, and this is due to the weakness of the structures in old age. Also the comorbid conditions are more in older age, so the intra-abdominal pressure also rises in old age. So all this leads to the protrusion through the posterior wall of the inguinal canal, and that is called indirect inguinal hernia. The protrusion takes place in the region of the Hasselbach's triangle, and we divide this triangle into two parts, lateral part and medial part, by the obliterated umbilical artery. And when the protrusion takes place through the lateral part, we call it lateral direct hernia, and when it takes place through the medial part, we call it medial direct hernia. Once again, appreciate that the protrusion is not taking place in case of direct hernia through the deep inguinal ring, but through its posterior wall of inguinal canal, and the protrusion is taking place in the region of the Hasselbach's triangle, and the protrusion takes place medial to the inferior epigastric artery. Now what are the coverings of the lateral direct hernia? So I have shown you the line of descent here. So when the protrusion takes place, it takes place medial to the inferior epigastric artery. This is a lateral direct hernia. So the protrusion, the coverings of the protrusion will be the peritoneum, extraperitoneal connective tissue, and since this protrusion is not taking place through deep inguinal ring, the covering will be fascia transversalis. And since the protrusion is taking place through the fascia transversalis, the next covering will be the cremastric fascia, followed by external spermatic fascia. So internal spermatic fascia will not form a covering of lateral direct hernia because the protrusion is taking place through the fascia transversalis. So instead of internal spermatic fascia, the fascia transversalis is forming the covering of lateral direct inguinal hernia. So the coverings, I'll repeat again: peritoneum, extraperitoneal connective tissue, fascia transversalis, cremastric fascia, and the external spermatic fascia and then the skin. This diagram is showing the coverings of the medial direct inguinal hernia. So the line of descent is shown by this line here, and see the coverings in this case. They are peritoneum, extraperitoneal connective tissue, fascia transversalis. Then we have the conjoint tendon. So since we have the conjoint tendon, in this case the next covering will be the external spermatic fascia and then the skin. So the internal spermatic fascia is not a covering in this case, and the cremasteric fascia is also not a covering in this case. So the coverings of a medial direct inguinal hernia are peritoneum, extraperitoneal connective tissue, conjoint tendon, external spermatic fascia and the skin. Now, complications of inguinal hernia. When the hernia begins, it is possible to reduce it, but after some time it may not be possible to put it back into the abdominal cavity. So initially it may itself go into the abdominal cavity. Later on we might be able to push it into the abdominal cavity. So that is called reducible hernia. But subsequently we might find that we are not able to put it back into the abdominal cavity, and such a hernia is called irreducible hernia. Obstructed hernia means that the lumen is obstructed of the protruding viscus. Strangulated hernia is an emergency. Here the blood supply is compromised, and in this scenario emergency operation is required for the inguinal hernia. Now in this diagram we can appreciate through this diagram the ring occlusion test which is done for the indirect hernia. Now in case of indirect hernia, the protrusion is taking place through the deep inguinal ring. Since the protrusion is taking place to the deep inguinal ring, what the clinician does is that the clinician reduces the hernia. So it is put back into the abdominal cavity, and then the person is asked to cuff. So if a movement is felt in the region of the deep inguinal ring, it means that the protrusion which was taking place has taken place through the deep inguinal ring. So such a hernia is called indirect inguinal hernia, and we say that the ring occlusion test is positive in case of deep inguinal hernia, because we have reduced the hernia and put our finger here and occluded the deep inguinal ring. So if on cuffing the contents they try to push out through the deep inguinal ring and hit the finger, it means that the type of hernia is indirect inguinal hernia. While if on reducing the hernia the contents do not push through the deep inguinal ring, it means the protrusion is taking place medial to the deep inguinal ring, and such a hernia is called direct inguinal hernia. So the ring occlusion test is an important test to distinguish the indirect and direct inguinal hernias. Treatment of inguinal hernia. It involves removal of hernial sac, and for such a procedure we use the term herniotomy. What is herniorrhaphy? This involves herniotomy, that is excision of the hernial sac plus repair of posterior wall of the inguinal canal. So when the protrusion is taking place through the posterior wall and we want to make it stronger, so in that case we can do herniorrhaphy for the direct inguinal hernia. And what is hernioplasty? This involves removal of the hernial sac plus reinforcement of the posterior wall of the inguinal canal with a synthetic mesh. So here we provide additional protection in the form of a mesh to reinforce the posterior wall of the inguinal canal in case of direct hernia. So these are the surgical options for the inguinal hernia. So this slide is just reinforcing the effect of increased intra-abdominal pressure on development of inguinal hernia. So chronic cough or lifting weights, comorbid conditions, they all increase the intra-abdominal pressure, and that leads to abnormal protrusion of a viscus or a part of viscus through an area of weakness which is produced by the descent of testes, and this type of hernia is called the inguinal hernia. So thank you. And if you want to read the notes related to today's class, you can visit this site busdesire.com and you can view my online book there. So thank you.